These are the mental health team. We've got an officer and a nurse. Okay, let me go.
My name is Shayla Skanga. I'm a registered nurse.
It's no building.
What's your name? It's locked. My role is to work with the officer in terms of de-escalating people who are in crisis.
I don't know where he went.
So many people gathering out here. Don't.
Usually respond to calls with primary response officers and help them decide whether somebody needs to be apprehended under the Mental Health Act.
Sure as hell ain't say, oh, Adam, I love you. I just see you guys wear police uniforms. What do you got?
I'm a nurse.
I don't like being locked behind doors. You know what that is? I've heard of people locking the...
Can you just try to focus on our question?
Yeah.
Yes.
Yeah. So,
female that can now. The shit's green. It could be anybody. Now you guys are police officers now. You guys are not. I smell the third water of approval right here. She knows me. Keys and things, okay? I don't ever want to see a car driven by me.
So we're here because it sounds like there's been a lot going on.
Okay, but what would you like me to do? Because honestly, maybe you want me to calm down.
I do. Can you take some breaths? And when someone hears that there's a nurse involved, it can help with decreasing their anxiety and fears.
No, I'm not. I was just there. Sure. I'm not going to hospital. I'm sane. I'm totally fine.
We might have to apprehend you under the Mental Health Act.
Okay. I'm going to the hospital. Okay.
The other guy that lives here, right?
No, this is the fun time, right? This is the fun time. I love it, right? And I'm not going to do what next, right? Something that you're not going to stop and something you're going to...
When a person's in crisis, and it's an emergency crisis, there's an immediate public safety concern. The person might need to be secured from harming themselves or harming somebody else. That's why we send our frontline uniform officers first. But if we sent the crisis team first, it would be a single police officer dealing with an uncertain situation at the time, and a nurse who is not either authorized or trained to deal with a public safety issue that might result in a police officer having to make an apprehension and using force.
Well, I would probably take the model that's working well in Hamilton. They have teams such as we're talking about there who are actually designated as first responders. Now, they obviously are not going to go charging in if a situation is unsafe, so there's a process to make the situation safe. But they've been very effective as first responders, and I highly recommend that.
Resources are ultimately and confoundingly for society always the limiting factor.
This is the revolving door part. And, also, how do you manage the use of crystal meth along with mental illness? It seems that they're just dealing with the imminent presentation, and then that's it. Follow up doesn't seem like it's going to happen. Do I walk away sometimes and think things could be different? I wish things could change within the system. Absolutely, but I can't operate on thinking that things are going to change dramatically, or I'll burn out.